World Health Organization is calling for the immediate targeting of babies yet to receive vaccines to stem the spread of measles in parts of the country. Parts of the country has been hit by an outbreak following weeks of shortage of the critical vaccines. Deputy Director General Dr. Ansu Benije, who has been speaking exclusively to my colleague Blessed Soga, says the WHO is concerned about measles outbreak in parts of Ghana. He also reveals that Ghana has been placed on the list of countries that will receive further funding from the Vaccine Alliance platform, Gavi.
During the pandemic is that many of the companies that produced vaccines had to shift some of their production lines for routine immunization towards production for COVID vaccine. And that has, let's say, from 2021, let's say, when the vaccine was started to be manufactured, has of course shifted, let's say, the global availability of some of the vaccines. Of course, we are coming out of that situation now, and so it is important that countries reinvest in accelerating the immunization towards immunization coverage. WHO has been working, and I think around 20 countries have been identified as priority countries to look at bringing immunization coverage back up to where we were before the pandemic. And this, of course, links very much to what I highlighted around the increased number of children from 19 to 25 million by 2020 that didn't have either a single or not all of their doses of immunization. So I know that the Ministry of Health in Ghana has made arrangements, and I think vaccines are coming into the country to allow to recapture, let's say, some of the losses in immunization coverage.
And for instance, some of the multilateral platforms available to us that are supposed to extend help to us through, for instance, Gavi. In the context of Ghana, for instance, we understand that that help will no longer be available for us in the coming years through the grants and support schemes that we get. So how do we approach some of these issues? Because the potential that it may affect the universal health coverage will definitely come up.
So I think in relation to Gavi, there has been an extension for Ghana to still benefit from the support from Gavi. And what Gavi, of course, provides is that it has ensured that vaccines are available at a much lower cost for low-income countries in order for them to be able to introduce it. And this is a huge advancement in equity, I think.
The full interview is on Foreign Affairs on the JoyNews channel today. Now, the Pediatric Society of Ghana is pushing for international health agencies to assist in tracking cases of the outbreak as the Ghana Health Service conducts its revaccination of babies who have missed their jabs. Dr. Adabi Apia is outgoing president of the group.
There was an initial outbreak which was reported from the northern region, but we know that it was not only the northern region. We're having some cases, but the problem in other regions like Ashanti, and then now we've also mentioned the Volta region from, I think, the last few days, is the fact that we are unable, message news from our colleagues from the field is that we are just unable to confirm most of these cases. And this is where there's another challenge. In fact, it's important that we confirm these cases. The other thing is that with the outbreaks, we are going to continue to see these outbreaks. And we have also, in the statements that Pediatric Society have issued, we have appealed to government and also our developmental partners to support us with diagnostic equipment, help us track and trace the cases so that we can identify them early, institute infection prevention measures both at home and then also in hospitals, just like we did with COVID, to be able to arrest the situation and also care for those who are at risk.
And I must state that that conversation with the Deputy DG of the World Health Organization, there's another leg to that conversation which we haven't put out yet. The portion about the calls for a targeted immunization for persons who may have missed that window at the time we're experiencing the shortage. The advocacy from the World Health Organization is that we go back to carry out that exercise and to protect that population. How do we approach that? Because that must be a difficult task.
Yeah, I guess Ghana has done well. Let's take a step back and look at what we have done with vaccination immunization program. In fact, the managers of our immunization program, they have really been excellent. They have done pretty good. But for the fact that we did not have the vaccines in the system, we will not be sitting here having problems. They have done catch-up, if I can use that terminology, programs before, like immunization days where government put resources into it and then provide vaccine, and then across the country we go to homes to vaccinate, and then all areas to find kids and vaccinate them. These are things that we have done it before, and then I know the EPI program is excellent. I mean, we are doing excellent. So once this has come up, and they have also, Ghana Health Service actually have highlighted the fact that they are going to do this. So we Pediatric Society have the assurance, we have faith in the system, and that once we provide the resources needed for this to be done, we know that the catch-up, we are going to catch up. It will take a little bit of time. We need to understand that we need to provide them with all the supports that they need to go out and then do this. And as you can see from your own news items that you carried since the past few days when the vaccines came in, the public health nurses are available. They are ready to do. They are all excited. Families are also excited hearing that the vaccines are in, thanking God for the vaccines being present in the country. So